We have a pinch hitter, little known fact. I recruited Dr. Newman actually to play on my medical center softball team 35 years ago. And truth be told, Kurt can hit. Field, I don't know, but he's a hitter. He's gladly agreed to sort of rearrange his schedule, and he's going to do his update now, and then we will bring Dr. Donahoe up. So it's my pleasure to introduce our president and CEO of Children's National Hospital, Dr. Kurt Newman.
Well, thank you, Mark, and it's great to see everybody. Mark, I could draw upon my pediatric surgery background, and I don't know if Dr. Donahoe would want me to give his talk around neurosurgery, but we could have talked about a few things. But it's wonderful to hear the clinical presentations, and thank you to the network for putting this on, and thank you for bringing this meeting, this network to our new campus. In some ways, it is the future of pediatrics, to be in an auditorium on a campus where there's research and innovation going on for children, startup companies, genetics research, rare disease institute, primary care. You could just feel the advances and discoveries that are going to be coming out of this ecosystem, and then be applied directly to patients because they're here. And if you get a chance, for those of you that are here in the audience, and it's great to see so many of you here, and then the 200 or so people that are online. Please make sure to come out and kick the tires and see what's going on out here, because it's just going to continue to be, we're going to continue to see progress. We just opened up this year, and you can already feel the just different pieces coming together. And it's really the first that we know of in the ecosystem like this, in terms of research and innovation that's devoted to children. And you think about where this location is, and it's hallowed ground because this was a military base, it was a hospital, there was a lot of research that went on for the United States Army, and we're continuing that tradition. But we're also in a sense, the epicenter of life sciences research, and you can just feel with our proximity to the NIH, to the FDA, to all the medical schools, to the government, and everything that goes on, putting pediatrics and pediatric research at the forefront. This gives us that opportunity to highlight the need for pediatrics. So you'll be hearing from Dr. DiBiase shortly about a $40 million grant that she and her team were able to get, and she'll talk about it, I'm sure, to look at the long-term effects of COVID in children. And that wouldn't happen if we didn't have these types of resources. And so that's where Children's is headed. I just see great things ahead. And it's also wonderful to have some celebrities in the audience. We have two presidents of the American Academy of Pediatrics. Sandy Chung and Lee Beers are both here, and thank you for your commitment and hard work and leadership around pediatrics. And then I have to say, Mark talked about my abbreviated softball career, but the Bad News Bears are still going. And although I have to get a pinch runner now if I ever do get a hit. But there are some people here that I started out with, and one of those is retiring, and that's Ellie Hamburger. And Ellie, I know there's a celebration of your contributions in your career tonight, but I didn't let her go. She's going to be serving on the Children's Hospital Board as a representative of pediatrics primary care, and we're thrilled about that. So thank you, Ellie, for agreeing but you are taking a vacation, right? Before you do that, or you already did. I can't remember. Just wanted to give you a couple of updates about Children's National, what's going on, and then leave some time for questions. As you know, for all of you and your practices, the impact of the pandemic has been on your operations, how you practice, and your finances has been intense challenges, and Children's National is no different. So, but I want to reassure you that we have not backed away from our mission. And if I think I can probably do this. Many of you don't know exactly what this triangle means, but it's how we set up the picture of our mission for Children's National. And at the base is our now 151. This is our 150th birthday was last year. We had to put off the party. We're going to do it. We're having it this year. But we were founded after the Civil War, and it was really to take care of kids that had nowhere else to turn. There wasn't much medicine, but some people got together. And what I love about the story is that the doctors at the time, they weren't pediatricians because that really wasn't a thing at the time, came together and said that they would donate their time to care for these kids, no matter what they needed, whether it was because they were orphans or because they were crippled children. And that's mission has served as the foundation for our hospital's mission for 151 years. Not every children's hospital has that same kind of mission, but that's the foundation. And what that really means is trying to develop a comprehensive health system for children in the region. The network is part of that. Our merger with the HSC, the Hospital for Sick Children, that many of you know, that was 135 years. And Nathaniel Beers is here, my colleague, who is president of that. We thought that coming together would be to create a more seamless care for particularly the most complex children. And that's working well. We're halfway through that. A health plan came with that. And you can just kind of feel how we're building this health system that at the heart of it is around our community and our community health. Several new health centers have opened up. We've committed to working with George Washington in Ward 8 in Anacostia on a new hospital. We'll be providing the neonatal services. We're working with many other hospitals across the region around their neonatal intensive care units. So really trying to provide community health across the board. We remain committed to the clinical excellence, so the specialty care that you all know that we provide at outpatient centers, but also at our main Michigan Avenue campus, the surgery, the inpatient care, the imaging. But where we can, we are also distributing that out into the region and the community as far south as Richmond, out to Frederick, down to the Eastern Shore and Southern Maryland. So really across the region. And then finally, our research and innovation, and that should also include education, which is that blue. It's signified by this new campus and the growth of our research. 20 companies have spun off out of Children's National's research. And our education and our programs have never been more popular. The number of people that are applying for our pediatric residency, for example, has never been higher. And our diversity, I should say, we're 3 times the national average for underrepresented minorities entering into our internship class. And that has gone up from, I think, 15% 5 or 6 years ago to now 45%. So we're really excited about those moves forward on all sides of the triangle. If the people talk about rankings, and you have to take everything with a grain of salt, but I'm excited to say that this past week, the U.S. News and World Report rankings came out for the top children's hospitals. We achieved our highest rank ever, or tied for our highest rank ever. We were number 5 2 years ago, and then we're number 5 again. When I started as CEO 11 years ago, we were ranked 18 and dropping. No children's hospital has ever had a faster climb to a top ranking like this, and we're very pleased. To me, these, although they look at different specific specialties, what it means to me is that you're strong across the board. You can't have a ranking in, say, neonatology of number 1 if you don't have strong genetics, radiology, anesthesiology, primary care. It takes a team. Nursing, respiratory therapy, it takes a total team. And almost all of our programs are moving up into the top 10. There's one that stands out, and just frankly, we're diving into why the cardiology and heart surgery is ranked so low. Basically, you all are, you all know data. The way the cardiology and cardiac surgery rankings go, it's not risk adjusted properly. So the more complex cases you do, generally the lower your ranking is going to be, because your morbidity and mortality are going to be higher. And that creates a real perverse incentive for programs not to take on the hardest cases. We've decided that that's not the approach we'll take. We'll take the complex cases, and this is part of the result. It's not all of it, but it's part of the result. But I just wanted to share you how we analyze these things. We use these rankings to improve our care, and our quality and safety has never been better. And I think if you've worked with our neonatologists, for example, you'll know that that number 1 ranking 6 years in a row is well deserved, and we're really proud of that. And it's why a lot of the hospitals in the region want to work with us and have us run their neonatology services, whether it's Virginia Hospital Center, or whether it's Mary Washington Hospital, or whether it's a number of the other hospitals in Northern Virginia and in Maryland. And now George Washington University and Howard University have joined this past year. So great news there. But what I tell people is that specialty care, if you looked at the top 10 children's hospitals, and you know who a lot of them are: Boston, CHOP, Cincinnati, Texas Children's, not in that order, and a number of others. If you looked at their commitment and how they're serving the community and their investment in the community, nobody would outrank Children's National. One measure of that is, of all the top children's hospitals, we have the highest rate of children that are on Medicaid, almost over 50% and climbing. That shows our commitment to our community. We embrace those kids. We want to take care of those kids. And a lot of the children's hospitals on those lists have very different strategies and approaches. So I'm really proud of that, and I appreciate all of the support that you, as pediatricians in practice, provide to help us do that, because that's also a team effort. And so, we're continuing our commitment in that way. And I think as we look forward, we've lobbied hard for U.S. News and World Report to include that in their rankings. Why isn't primary care on this list? Why isn't mental health on this list? And so I'm pleased to say that we've had an impact. And Dr. Shaw, I think they're going to start now including some of those markers and metrics in their analysis. We are very concerned, and there's been a lot of discussion, and I know in your practices, yeah, you're feeling this, the impact of the pandemic and many other things on healthcare workers. And we were just excited a couple of weeks ago to have the Vice President of the United States, Kamala Harris, with the Surgeon General, come visit Children's National to highlight the impact of the pandemic on healthcare workers. This is just a small snippet of how we're trying to work with our doctors, nurses, other healthcare workers to look at the challenges of career, of family life, of the practice of medicine, to not shy away from it or hide from it, but to put things in place. We're worried about the mental health issues that many physicians, nurses, healthcare workers are facing, either themselves or their families. This is a work in progress, but we were, again, being in Washington, D.C., being the children's hospital in our nation's capital gives us some extra special leverage and opportunity to talk to top leadership of our country about issues that matter. And in this case, it was healthcare workers. That's true and we'll hear about the pandemic. It's also true about gun violence and other issues that we need to take head on. And so I know that we'll be continuing to have that type of impact and interest in advancing what's right for children and families. And then finally, just this week, I just have to highlight it, and I think Dr. DiBiase will mention it a little more, but I was pleased to see, was it yesterday even, Mark, you had one of the first clinics where children were getting vaccinated with the new vaccine right here in this room. And one of our pediatricians, I think, in another picture was vaccinating her own child or just holding the child while somebody vaccinated. She gave the shot? Okay. I was going to say that may violate something. My son looked at this picture and sent me a note, and he said, "Dad, that looks like one of those pictures of, back from the Rembrandt or where the mother's holding the baby Jesus and there's everybody gathered around." But he was not an art major in college. Anyway, it just shows the passion of our teams. I'm so proud of our primary care teams in some of the underserved communities, and that's where we've been highlighting our vaccination efforts, along with the kids that have chronic diseases and really need that. But this is a continuing effort, and again, it'll be to be successful. We have to continue to work together. That's why I'm so, again, honored to be invited to speak. And thank you for all of your support of our hospital, our doctors, nurses, and our team members in whatever dimension that you're working with us. And that's, why I think we can all be proud, and I hope you're proud that we're a top 5 children's hospital. And I think we can probably go higher. And that's our aspiration, but it's not about the ranking. It's more about what it means. And it means excellence in care and in delivering on the promise of Children's National Hospital. So thank you all. Mark, I don't know if you wanted to have questions or move on. I'll leave that to your.
Welcome to entertain a question or two. But we're And so I would first thank you for being here and leading Children's National. I would also say thank you for your strong commitment to supporting pediatricians in community practice, as well as supporting the build out of our pediatric health network to improve care. And thank you so much.
Okay.